You know what's completely backwards about how most chiropractors think about money? Well, they believe that accepting every single insurance and keeping fees low attracts more patients. Or they feel they need to be an adjustment factory seeing 100 patients a day. Sorry to burst the bubble, but that's completely wrong. And after working with hundreds and hundreds and hundreds of independent practices, I've discovered something that changes literally everything. The doctors commanding the highest fees and attracting the most committed new patients are the ones who position themselves as premium cash pay practices along with insurance. And here's what nobody tells you. When you build your practice around insurance and discount pricing, you're not just leaving money on the table, you're actually attracting the wrong patients entirely. Let them go. You can't serve them all. The ones who shop on price, they cancel constantly, they no-show, and they disappear after their insurance runs out or the moment they start feeling a little bit better, well before their problem is stabilized. So today, let's talk about exactly why cash pay positioning can transform not just your revenue, but the entire quality of your patient base. You're going to discover why higher fees actually increase patient commitment, why insurance-free practices have oftentimes better outcomes, and how to position yourself as the premium choice in your market. These aren't theories. These are patterns I've watched play out in practice after practice after practice. So here's the truth that will make you uncomfortable. Your practice signals your value. And when you position yourself as the budget option, you attract budget patients. When you position yourself as the premium solution, you attract people who value results over costs. It's all about outcomes. Now, the first principle that most chiropractors miss completely is what I call the investment commitment effect. When patients pay out of pocket, they show up differently than insurance patients. They're more engaged. They follow recommendations more closely. They have more buy-in. They complete care plans, and they get dramatically better results. And I consistently see this pattern, across pretty much every market in the country. Cash pay patients have a 40 to 50% higher compliance rate than insurance patients because they've made a real investment in their health. So imagine two patients with identical conditions who start care the same week. Patient A is using their insurance and only their insurance, and they refuse to pay anything other than what their insurance will cover. Their copay is $20 a visit. They show up when it's convenient. They skip appointments. They stop coming in when they feel a little bit better. Patient B, they paid cash up front for a care package, or they paid cash up front for the care that the insurance did not cover up front. They don't miss appointments. They do their home exercises. They complete their full treatment plan. 6 months later, patient B is pain-free and referring friends. Patient A's condition is worse than when they started because they never finished treatment, and guess who hears about it? Their friends. Here's how you can benefit from this information. First, understand that cash pay isn't about excluding anyone. It's actually about attracting those people who are serious about results, whether or not they have insurance. When you present care as an investment in their long-term health, everything shifts. And then second, create package-based care plans that patients invest in upfront if they so choose. Not pay-per-visit models that encourage stopping care prematurely. That is very old school. When someone commits to the complete solution to stabilize their situation, they get complete results. And then third, position your messaging around outcomes, not transactions. Don't talk about adjustment costs. Talk about the value of being pain-free, of being active, mobile, and healthy for decades. When you shift to investment-based positioning, you naturally filter for or select for patients who value what you do, what you deliver. But attracting committed patients is just the beginning of why cash pay positioning works. And when I say cash pay, I'm not talking about an all-cash practice. The second principle that transforms practices is the administrative freedom effect. So here's what nobody calculates when they take insurance as their primary method of revenue generation. The true cost isn't just lower reimbursement rates. It's the hours spent on billing, appeals, verification, denied claims, requesting more visits, and insurance phone calls. In my experience, working with practices that transitioned from being insurance dependent to cash focused, they discovered they were spending 15 to 20 hours weekly on insurance administration. That's half a person's salary just to process low payments. Now think about what this looks like in real numbers right now. Let's picture Dr. Williams, who accepts insurance. He collects an average of $45 a visit after insurance processing. So let's say it's actually collecting $60, leaving a net of $45, which takes his staff 90 minutes per patient over the course of care. and that's being generous. Her actual revenue per hour of staff time is maybe $30 after you factor in the administrative work. So by contrast, Dr. Johnson runs a cash practice. He charges $75 a visit, zero insurance processing on a good portion of patients, maybe half of them. His staff spends that time on patient care and retention, generating more revenue. His actual revenue per hour is a flat 75. Same service, completely different business model. So here's what I suggest you do as soon as possible. First, calculate what insurance actually costs you beyond reimbursement rates. You've got to factor in staff time, software subscriptions, clearinghouse subscriptions, denied claims, cost of the opportunity cost of what else that time could create in terms of revenue generation. Now, most doctors discover insurance is costing them 30 to 40% more than they realized it was. That's a lot. And then second, phase out the lowest paying insurance plans first. I mean, you don't have to go fully cash overnight, nor do I want you to go fully. I would never recommend you go fully cash. But phase out the lowest paying insurance plans first. Don't get stuck in that endless cycle of trying to request more visits. If they only allow 7 and you've got to request every 3 or 4 more, how about you just go with 7 and the rest goes over to cash? But eliminating the plans that pay $30 per visit while requiring just hours of paperwork is an immediate win. And then third, redirect saved administrative time into patient experience and retention. When your team isn't fighting with insurance companies so much, they can focus on making patients feel valued. That transforms referrals. The freedom from insurance administration alone changes practice culture completely. Well, there's one more massive benefit most doctors never consider. And the third principle is what I call the premium positioning psychology. When you're the expensive option in your market, you're automatically perceived as the best option, unless you're over the top. This isn't about tricking people. It's about understanding human psychology around value. People assume higher price equals higher quality, and it should. And when you position yourself as the premium choice, you attract patients who win the best, who want the best, not the cheapest. But if you're charging the most, you need to deliver the best outcomes. Now, I've watched practices double their fees during a transition to increasing their amount of cash pay patients and see patient volume increase, not decrease, because they finally attracted their ideal patient base. Understand that premium positioning isn't just about price. It's about the entire patient experience. Your office environment, your communication, your results, your follow-through, the look, the feel, everything is experiential. And everything signals whether you're the budget option or the premium choice. Do you have rips and tears in your adjusting tables? Oh my gosh, you're not the premium choice. The walls need painted, you're not the premium choice. Is your office pristine? Everything's in tip-top shape. You could be the premium choice. And then raise your fees strategically, not apologetically. Oh, I'm sorry we had to raise the fees because of, cost of living, whatever. Don't do that. Present your pricing with confidence as the investment required for the level of care and results that you deliver. And then third, last, market to the right audience. Stop trying to attract every human being. Target people who already value health. They invest in wellness, and they understand that quality costs more than convenience. So when you position yourself as the premium option, you stop competing on price and start attracting patients who choose you because you're the best, not because you're the cheapest. You don't need to have those ridiculous signs out front, $25 adjustment. Now, here's what makes the cash pay positioning side of your practice sustainable long term. You need systems that make premium care accessible without discounting your value. The practices successfully running both insurance and cash-focused models haven't eliminated affordability. They've created legitimate financial structures that serve committed patients at premium prices. If you're ready to stop attracting price shoppers who never complete care and start building a practice full of committed patients who value your expertise, head over to apexlongevity.com. Discover how compliant cash discount programs let you maintain premium positioning while making care accessible to patients who are serious about results. Now, the doctors building the most profitable and fulfilling practices aren't the ones accepting every single human being with a pulse or every single insurance and patient and competing on price. They're the ones who figure out that both cash pay positioning as well as accepting many of the insurance programs attract better patient outcomes, create better outcomes, and build better businesses. It's a blended approach. Your choice isn't between making money or serving people. It's about attracting patients who value you or patients who use you. Time to choose who you want in your practice. If you've picked up just one piece of solid, actionable information, write it down, use it, implement it, and please share this segment with a friend. And if you'd be so kind, please leave a review, and I would ask you to be kind. Hope that you've learned at least one awesome gem that can help transform your practice. Have an amazing day.